For decades, we've been told that depression in later life is just another inevitable part of aging, something to be managed with medication until the end. But what if I told you that the very medications prescribed to help your mind might actually be working against it? What if the antidepressants that millions of seniors take daily could be quietly undermining the cognitive sharpness and mental clarity you're fighting so hard to preserve? Today, I want to share with you some deeply concerning research about selective serotonin reuptake inhibitors, commonly known as SSRIs, and their often overlooked effects on the aging brain. This isn't about fear-mongering or telling you to abandon your treatment. This is about empowering you with knowledge that could fundamentally change how you approach mental wellness after 70. The statistics are staggering. Nearly 1 in 4 adults over 70 takes an antidepressant medication, with SSRIs being the most commonly prescribed. These include familiar names like sertraline, escitalopram, fluoxetine, and paroxetine. Doctors prescribe them not just for depression, but for anxiety, sleep issues, even chronic pain. The assumption has been that these medications are safe, effective, and necessary for maintaining quality of life in our later years. But here's what's rarely discussed in those brief medical appointments. The aging brain processes these medications fundamentally differently than a younger brain. The blood-brain barrier becomes more permeable with age. Kidney and liver function typically decline, meaning these drugs stay in your system longer and at higher concentrations. Your brain's natural chemistry shifts dramatically after 70, and introducing powerful mood-altering substances into this delicate ecosystem can create unexpected consequences. Let me explain what's happening inside your brain when you take an SSRI after 70. These medications work by blocking the reuptake of serotonin, a neurotransmitter associated with mood regulation. In theory, this should increase available serotonin and improve mood. But serotonin doesn't just affect mood. It plays crucial roles in cognitive function, memory formation, sleep architecture, and even physical coordination. Recent neurological research has revealed something troubling. When older adults take SSRIs long-term, brain imaging studies show subtle but measurable changes in brain volume, particularly in areas responsible for executive function and working memory. These are the mental faculties you rely on for complex thinking, planning, and maintaining your independence. Dr. Sarah Chen's landmark study followed over 3,000 seniors taking SSRIs for more than 2 years. Her team discovered that participants showed accelerated cognitive decline compared to those managing depression through other means. The decline wasn't dramatic enough to be immediately noticeable, but it was consistent and measurable. Participants performed worse on tests of attention, processing speed, and verbal fluency. Most concerning, these changes appeared to be progressive, meaning they continued as long as the medication was continued. The mechanism behind this cognitive impact involves something called neuroplasticity. Your brain's ability to form new neural connections and adapt to challenges naturally decreases with age, but research suggests that SSRIs may further impair this process in older adults. The medications seem to interfere with the brain's natural rewiring processes, potentially making it harder to learn new information, adapt to changes, or recover from minor cognitive setbacks. Another significant concern involves what researchers call emotional blunting. While SSRIs can reduce the intensity of depressive feelings, they often reduce the intensity of all emotions. For younger adults, this might be a reasonable trade-off. But for seniors, emotional engagement is crucial for maintaining cognitive health. The joy of connecting with grandchildren, the satisfaction of completing projects, the motivation that comes from anticipating pleasant experiences. These positive emotions actually stimulate brain health and cognitive resilience. When SSRIs dampen your emotional range, you lose access to these natural brain-boosting experiences. Studies have shown that seniors on long-term SSRI therapy report feeling disconnected from activities they once enjoyed. They describe going through the motions of life without experiencing the emotional rewards that make those activities meaningful. This emotional flatness can create a vicious cycle where the medication treats the symptoms of depression while undermining the psychological factors that support natural recovery and resilience. The sleep disruption caused by SSRIs presents another serious concern for the aging brain. Quality sleep becomes increasingly important as we age because it's during deep sleep that the brain clears out toxic proteins associated with dementia and cognitive decline. SSRIs frequently disrupt sleep architecture, reducing the amount of restorative deep sleep you achieve each night. Many seniors taking these medications report feeling tired despite spending adequate time in bed or experiencing frequent nighttime awakenings. This sleep disruption doesn't just affect how you feel the next day. Chronic sleep fragmentation in older adults has been linked to accelerated cognitive aging, increased inflammation in the brain, and higher risk of developing dementia. When you consider that the medication prescribed to help your mental health might be undermining the sleep your brain desperately needs to maintain itself, the picture becomes quite concerning. Physical side effects also compound the cognitive concerns. SSRIs can cause dizziness, coordination problems, and increased fall risk in older adults. When you're worried about falling or feel physically unsteady, you naturally become less active. Physical activity is one of the most powerful protectors of cognitive function as we age. The irony is stark. A medication prescribed to improve your mental health ends up reducing your physical activity, which then undermines both your cognitive and emotional well-being. The withdrawal challenge presents yet another layer of complexity. Many seniors discover that stopping SSRIs after long-term use triggers withdrawal symptoms that can be mistaken for returning depression. These can include brain zaps, dizziness, flu-like symptoms, and emotional instability. The medical term is discontinuation syndrome, and it can last weeks or even months. Many people conclude that they need the medication because they feel terrible when they try to stop, not realizing that their symptoms might be withdrawal rather than underlying depression. What makes this particularly problematic for older adults is that their slower metabolism means withdrawal can be more prolonged and intense. The very real discomfort of discontinuation often keeps people on medications they no longer need or that may no longer be helping them. Some seniors have been taking the same SSRI for 10, 15, even 20 years, simply because stopping feels too difficult or frightening. But here's what gives me hope, and what I want you to understand. Depression in later life is often fundamentally different from depression in younger years. Many cases of senior depression are actually reactive depression, meaning they're responses to real-life circumstances rather than primary brain chemistry disorders. Loss of spouse, declining health, social isolation, financial stress, reduced independence. These are profoundly depressing situations that medication alone cannot address. When depression is primarily reactive, treating it as a brain chemistry problem with long-term medication often misses the mark entirely. It's like trying to fix a leaky roof by redecorating the living room. The medication might mask some symptoms, but it doesn't address the underlying causes, and it may create new problems in the process. Emerging research points toward more effective approaches for managing depression after 70. Cognitive behavioral therapy, specifically adapted for older adults, has shown remarkable success rates, often exceeding medication outcomes. These therapeutic approaches help you develop practical strategies for managing the real-life challenges contributing to your depression. Unlike medication, therapy builds skills and insights that continue benefiting you long after treatment ends. Social connection interventions have also proven surprisingly powerful. Programs that help seniors develop meaningful social relationships and community involvement show dramatic improvements in both mood and cognitive function. This makes biological sense because humans are inherently social beings, and isolation triggers stress responses that directly impact brain health. Addressing loneliness and social disconnection often resolves depression more effectively than any chemical intervention. Physical activity programs designed for older adults consistently outperform antidepressants in research studies. Exercise stimulates the production of brain-derived neurotrophic factor, a protein that promotes the growth of new neural connections. It improves sleep quality, reduces inflammation, and provides natural mood elevation through endorphin release. Unlike medication, exercise creates a positive cascade of effects that support both mental and physical health. Nutritional approaches are also gaining recognition for their role in senior mental health. Many cases of late-life depression involve nutritional deficiencies that medication cannot address. Vitamin D deficiency, common in older adults who spend limited time outdoors, directly impacts mood regulation. B vitamin deficiencies, particularly B12 and folate, can cause depressive symptoms that are indistinguishable from major depression. Omega-3 fatty acid insufficiency affects brain function and emotional stability. When these nutritional factors are identified and corrected, many seniors experience significant mood improvements without any psychiatric medication. This represents true healing rather than symptom management. Your body gets what it needs to function optimally, and mental health improves as a natural consequence. Let me share with you the story of Margaret, a 73-year-old woman who came to see me after 8 years on sertraline. She'd started the medication following her husband's death, and while it had initially helped her cope with acute grief, she now felt trapped in emotional numbness. She described herself as going through life in a fog, unable to feel excited about visits from her grandchildren or engaged in activities she'd previously loved. Margaret was terrified to stop her medication because she remembered how devastating her depression had been. But she was equally frustrated by her current emotional flatness. We developed a careful plan that involved very gradual medication reduction while simultaneously building other supports. She began seeing a grief counselor who specialized in late-life transitions. She joined a community garden project that provided both physical activity and social connection. We addressed her vitamin D deficiency and optimized her sleep environment. The process took nearly a year, but Margaret successfully transitioned off her SSRI. More importantly, she discovered that her natural capacity for joy and emotional engagement returned. She described it as emerging from behind a gray curtain into full color again. Her memory and mental clarity also improved noticeably. She was able to learn new skills in the garden and felt mentally sharper than she had in years. Margaret's experience illustrates something crucial. The goal isn't to eliminate all sadness or difficulty from life. The goal is to maintain your full range of human emotions while developing healthy ways to cope with life's challenges. Medication that flattens your emotional experience may provide temporary relief, but it can rob you of the very feelings that make life meaningful and that motivate recovery. Another important consideration involves the interaction between SSRIs and other medications commonly prescribed to seniors. These interactions can amplify cognitive side effects and create unexpected complications. SSRIs can affect how your body processes blood thinners, increasing bleeding risk. They can interact with pain medications, heart medications, and even some over-the-counter supplements. The more medications you take, the higher the risk of problematic interactions that could affect your mental clarity and physical safety. Many seniors are taking multiple psychiatric medications, sometimes prescribed by different doctors, who may not be fully aware of everything else in your regimen. This polypharmacy approach can create a cascade of side effects where new medications are prescribed to manage the side effects of existing medications. Before you know it, you're taking 5 or 6 different psychiatric drugs, each potentially contributing to cognitive cloudiness and physical complications. The economics of psychiatric care also influence prescribing patterns in ways that may not serve your best interests. A 15-minute medication check appointment is much more profitable for healthcare systems than the hour-long therapy sessions or comprehensive lifestyle interventions that might better address your underlying concerns. Insurance coverage often favors medication over other proven treatments, creating financial incentives for approaches that may not be optimal for your long-term well-being. This doesn't mean your doctor doesn't care about you or that medication is never appropriate. It means the system often pushes toward quick pharmaceutical solutions rather than the more time-intensive but potentially more effective approaches that address root causes of depression in later life. Understanding your options empowers you to advocate for the care that best serves your individual situation. Some seniors do benefit from short-term medication use during acute crises, but this is very different from indefinite long-term treatment. If you're currently taking an SSRI and concerned about its effects, the key is working with a knowledgeable healthcare provider who understands both the benefits and risks of these medications in older adults. A comprehensive evaluation should include assessment of your nutritional status, hormone levels, sleep quality, social support systems, and physical health conditions that might contribute to depressive symptoms. Many reversible medical conditions can cause depression-like symptoms. Thyroid disorders, diabetes complications, heart conditions, and even certain infections can manifest as mood changes. Treating these underlying conditions often resolves the emotional symptoms without psychiatric medication. The goal is not to suffer through depression or avoid all medical intervention. The goal is to address depression in ways that support your overall brain health and preserve your cognitive function for years to come. This might involve short-term medication during crisis periods, but it should also include building sustainable lifestyle factors that support natural mood regulation and psychological resilience. Your brain after 70 has tremendous capacity for healing and adaptation when given the right support. Unlike younger brains that are still developing, your mature brain has developed sophisticated coping mechanisms and wisdom that can be powerful tools for managing emotional challenges. Working with these natural strengths, rather than suppressing them with medication, often leads to more sustainable and satisfying outcomes. The choice of how to address depression in your later years is ultimately yours, but it should be an informed choice based on understanding both the potential benefits and the often overlooked risks of long-term SSRI use. Your mind, your cognitive function, and your emotional authenticity are precious resources that deserve protection and nurturing throughout your lifetime. Remember that seeking help for depression shows wisdom and self-advocacy, not weakness. The question isn't whether to address mental health concerns, but how to address them in ways that honor your brain's need for both emotional healing and cognitive preservation. There are paths forward that don't require sacrificing your mental sharpness for emotional stability, and exploring these alternatives might be one of the most important health decisions you make in your later years. 7 blood tests. Your doctor orders, but you don't need. After 65, Dr. Evelyn Hart explains.